the only expert, but I am very passionate about this topic. And again, I want to extend my gratitude to you all in engaging in such a critical and very sensitive conversation. I will note that at a given time, this may make you a little uncomfortable, or there might be some comments or conversations that will call into question some personal beliefs, but I know that we all are upheld to a certain ethical, professional ethical standards, and that is the intent for today on how to create inclusive and supportive environments when working with LGBTQ youth. So with that said, let's continue. We're looking at providing competent care, and I would actually reframe that to have some cultural humility around this population and this topic. And that means that we would have to surrender and acknowledge that there are a lot of things that we don't know. And so for the purpose of today is that we're just going to get a basic understanding and having some basic facts on LGBTQ youth and the issues they face. This conversation is going to be developed a lot further in the 3-hour workshop that will be held at the conference come October. And for the purpose of today and then, I do want to create a safe space for these conversations. So please ask any question, and I will do my best to answer you. If not, I will take notes, and anything that I don't have at this moment, I will make sure I disseminate to the rest of the group. So let's talk about what LGBTQ means. It might be a little elementary for some people, just depending on where we are in our learning curve, but I do want to establish a foundation before we dive into a more in-depth topic about being Latino and being LGBTQ. So when I say LGBTQ, I am referencing any individuals and communities that identify as lesbian, gay, bisexual, or transgender, or those who are questioning their sexual orientation or gender identity. And this acronym is specific to sexual orientation. And as you see, we have other acronyms, GLBTQ, LGBT, QQIA. So the first is just a rearranging of the letters. But when we look at the longer one and a lot more inclusive, we have 3 additional letters at the end that to some people might be new or not. And so the second Q would be queer. And I understand that that word can be a little sensitive, so my disclaimer is that I use it as an umbrella term. This term was actually offensive at a given time, but it has been reclaimed, and it is important to note that for the purpose of this presentation, and with your permission, I will use the term queer in the most inclusive and umbrella term. We have I for intersex and A for asexual. Both the term intersex, we won't be diving too deep into that, but this warrants a different conversation, and I do want to note that our intersex community is part of this larger conversation. And when we talk about intersex, it sometimes goes undetected, and this population at times can be very invincible because we don't create spaces to have their conversations about their needs or their experiences, but 1 in 10,000 people are born intersex, and decisions are made at time of birth that will affect their gender identity and their sexual orientation later on in their development. A great film to look at that I will refer to will be the film Orchids. But again, for the purpose of today and the short amount of time that we have, I will not be addressing this topic too much. But let's start unpacking this topic of gender and sex before we dive into sexual orientation. And a couple of definitions that I have listed now are sex as a biological marker assigned at birth, usually male or female. And keyword here is assigned. At time of birth in a hospital setting, we're either assigned a blue or pink blanket. Our driver's license as well has a box to check as either male or female. And while this is what we're used to and what has become societal's norm, it's important to note that when we're working with gender nonconforming individuals, that can be very restricting. And we have actually, in Germany, there's been a third gender that has been offered at time of birth for birth certificates and for families to determine at a different time which sex they want to decide for their child. But sex is a biologically marker that's assigned based on our genitalia. Now, when we look at gender, we have gender identity and gender expression. Gender identity being that personal, deeply felt sense of being a man or a woman or something in between. And our expression is those characteristics and behaviors such as appearance, dress, mannerisms, speech patterns, and social interactions that are perceived as either masculine or feminine. And the takeaway with this is to understand that all of our gender and our sex is on a spectrum. We are very comfortable and we tend to live in a binary. And I ask you to challenge yourself to look at the gray area in between, because in working with this population, there's a constant fluidity between your identity and your expression. So to unpack a little bit more about gender identity, again, it's that internal sense of self. So growing up, I was very well aware that I was a girl. I loved being a girl. I loved wearing pretty clothes and dresses and little shoes that made noise when I walked. That was my sense of self. And when we're working with transgender populations, we have to understand that their birth assigned sex does not align itself with their gender identity. And so at times there will be an effort to match that. But when you have that conflict, we need to create spaces to have those conversations and not be fixated on the alignment of your sex, your identity, and your expression. So what is expression? Again, it's this manifestation of your gender identity. So if I have a perception of myself as a female, as a woman, I tend to express myself in that given way. But again, that can alter. Today I chose to wear a dress and paint my nails and wear makeup because my expression of my gender is that of a feminine woman. But I can change that come tomorrow if I chose to wear slacks, pull my hair back, and wear a collared t-shirt. So we have to be comfortable with that fluidity, and you'll see that in a lot of youth. Sometimes they will walk in wearing nail polish. That doesn't change their identity or their sex assigned at birth. That is how they are manifesting their sense of identity for the day. And when we talk about transgender populations, we're looking at their gender expression matching their identity. But I must note that this is an identity-based model. This is not a medical or hormonal model that requires medical intervention. So our trans population at a given time will choose not to undergo certain surgeries, or they might not have access to that type of health care. So when we talk about our trans population's gender expression and matching their identity, it is not a medical model, but rather an identity-based model. So I hope I'm not going too fast. I do want to cover a lot in the short time that we have today, but again, please pose any questions that you may have up until now. And now that we've unpacked a little bit of gender identity, expression, and sex, now we can look at sexual orientation and note that there's a couple of components here. We're looking at identity, behavior, and attraction. So when we discuss identity, it is important to note that our heterosexual communities also have a sexual orientation. I think at a time we live in this heteronormative environment where we just take that to be the norm, where we just assume that everyone is straight or is heterosexual, but that too is an identity. We're looking at our gay, lesbian, bisexual, and pansexual identities as well as behavior. In working in child welfare, I have encountered a lot of youth that will engage in same-sex, both-sex, opposite-sex, and all-sex contact at a given time while in juvenile halls or in group home environments, but they don't identify. So that's important to note, that your behavior isn't going to always dictate your identification. But I think the safest and best definition that I can suggest in working with youth or anybody for that part is asking someone who they are romantically, emotionally, physically, and spiritually attracted to. That really encompasses and captures your sexual orientation. So a great illustration of all that we've discussed so far is our genderbread person. This is a safe, it's friendly illustration of what we've discussed today. So you look to the spectrum on your right. You're looking at gender identity, gender expression, biological sex, and sexual orientation. And in most cases, again, I'm asking you to deviate from that binary. We are under the assumption that we all align ourselves to the far left or to the far right. But in working with LGBTQ communities, there's going to be a variation of that. And it's important to be cognizant of that, to be comfortable with that, to be willing to understand what that manifests and what that looks like in working with a lot of different youth and individuals. So something else to be aware of is that LGBTQ people may become aware of their orientation and identity as a child or even as an older adult. In this case, I reference a film called The Normal that was put on by Showtime. I had the opportunity to watch it, and it captures the experience of an older white male. I believe he was in the Midwest, who went through a transition. He was transitioning from male to female as a husband and as a father to 2 children. And so it's important to note that we are not dictated by any timeline to say this is when you transition, or this is when you identify, or this is when you are expected to come out. So you're never too old and you are never too young. It is an ongoing process. It's a lifelong process. And at a given time, I also have to navigate that need or that importance of coming out. I'm not obligated to identify as a queer woman of color, but I choose to, because that is how I identify, and in given spaces based on safety as well. It's important to note that coming out is, most cases, dictated by safety and safety concerns, whether or not it's an inclusive environment, whether or not you will be hurt in a given space. So, and be mindful that not everyone has to come out, that there's no obligation. There isn't a means to an end. So people have their own processes in deciding whether or not to come out and identifying their sexual orientation to others. Also, in asking yourself, how do I know if I'm gay, or how do I know if someone else is gay, is to never assume what someone's identity is like based on any myths or stereotypes. The media perpetuates a certain idea of what it is to be gay, or how to behave, or how to talk, and what mannerisms to display, but not everyone looks like Will and Grace, and the only way to be certain is if someone tells you. And that in and of itself is an honor, and it's something to be mindful of, that you want to create inclusivity, you want to create safe spaces in working with this population where you're going to be chosen. You are going to be chosen to be told, or someone decides to come out to you, but it is not a requirement. So now that we've establish a foundation as to sex, gender identity, and orientation, I want to dive into a very specific and very sensitive and topic that I really hone in on, and that I really think it's important to create spaces to have this dialogue, because as a Latina and as a lesbian, there aren't a lot of spaces to do so, and there's a lot of silence behind this. So let's take some time to look at this topic more in detail. And I will note that for the purpose of this presentation, we are looking at the Latino and Latina population. But if we were to do the same work with African Americans and Asian Pacific Islanders, we may or may not find some similarities. But again, for the purpose of today and for the conference in October, we will only be looking at this population. And my other disclaimer is that when I use the word Latino or Latina, I understand we are not a homogenous group. We are very diverse. We use different languages. We have different experiences, and we have different cultural expectations. But for the purpose of today, I will be using this term to address a larger group. So the goals and objective for the purpose of today is to understand the role of machismo for Latinos, and describing the importance of family for our culture, as well as understanding the role of the church for an LGBTQ Latino. So in doing so, I wanted to quote Sandra T., a Mexican-American activist. And what she says is that there are so many significant experiences in my culture that have something to do with a person's life as a heterosexual. And what she's alluding to are these cultural milestones that we engage in as Latinos that are dictated by heterosexual orientations. So when we talk about marriage, or for instance, when my mom awaits the day for me to walk down the aisle with a white dress, she is not expecting to see a woman at the altar. The expectation would be that of a man. And there are certain churches and religions that will not wed my partner and I. So our culture and our experiences are very much dictated by heterosexual expectations. As another example would be quinceañeras. For those of you who have attended a quinceañera, which would be the equivalent of a sweet 16, You will never see a chambelán that is of the same sex. And a chambelán would be your escort, would be that individual that you're paired with, and it's usually a woman and a male. I've yet to attend a ceremony of any sort where we had two females. And even the attire for the day is very dictated by femininity and your gender being expressed in such a way with a long, big, puffy dress. I've yet to see a quinceañera wear slacks. So it's important to note that in our culture, there's minimal space for negotiation. And for gender nonconforming youth, this can be very suffocating. And I've asked you to deviate from those categories and to really empathize and understand what are the needs for a lot of these youth and population as Latinos. So let's look at LGBTQ Latinos and our family and what support looks like. So it's imperative for us to maintain these strong relationships with our families, and it really feeds our identity. It's at a given time, it can be an expectation, but it's very important for you to have a good relationship with your family. Some of us come from larger families. I think the stereotype is that we all come from large families, but that isn't always the case. But it's important to note that the possibility of losing the support of your family can be very, very, very devastating because you're a subset of them. You are a reflection of them. So it's mutual to lose out on that support. I'm very connected to my parents, and so much so that I have dinner with them at least 2 to 3 times a week. So to think that you would lose that simply because of your sexual orientation can be very difficult. But regardless of that, it's important to note that a lot of Latinos are still coming out. I don't have any data on that other than anecdotal evidence that amongst my peers and also a youth focus group that we held here in our offices about 2 years ago with 16 youth between the ages of 15 and 19, and doing a roundtable and a check-in with them, they shared with us the age in which they came out to their communities and to their families, and the median age was about 13. So we're starting to see a change in conversation, and even in the media, you're seeing TV shows that are highlighting LGBTQ individuals, not always Latinos, but we are creating spaces for these conversations, and we're, as professionals, also need to create inclusivity and safe spaces for these youth to seek support from us as therapists, social workers, physicians. So moving forward, let's look at some basic terms. Again, basics. So we have la familia, translation to family from English to Spanish. Machismo, which is this hyper masculinity that dictates a lot of our interactions and our relationships as Latinos. Respeto, which is translation to respect, as well as Marianismo, which would be with the opposite of machismo. It's this reverence for the feminine virtues of purity and moral strength, and it respects that binary of the virgin and the whore. And that also dictates a lot of our interactions and expectations as young Latinos. And so it's also something important to note that when we're talking about gender nonconforming youth and their need to identify and that age when you're exploring and you're understanding your role and who you are, it can be very difficult within our communities. Just even looking at our language, for instance, it's very gendered. Our language translates all of our nouns from feminine to feminine or masculine. So when I say la puerta, the door, I've labeled the door feminine, not because of a biological assigned sex, but because that is our language. That's how Spanish is spoken. So it's important to note that that can also create really difficult spaces for LGBTQ individuals and how that dictates our experience of the world. So let's look at the treatment of LGBTQ Latinos or Latinos. That within this world of machismo, as I said, hypermasculinity, we are looking at how Latinos or even transgender Latinas can be suspected of homosexual if that behavior doesn't align. So when we looked at the genderbread person, we saw that alignment. When you deviate from that, it's when you create conflict, is when at times you can be disrespected and abused or even hurt. As a social worker and as a program manager for a child welfare program, we see a disproportionate amount of youth that are LGBTQ youth in foster care. And a lot of the time these minors go unnoticed and are very much invincible. But the reason for their representation in foster care is because of physical abuse and rejection by their own families. A great study that just came out a couple weeks ago by the Williams Institute is Sexual and Gender Minority Youth in Foster Care, and you can access this online. It is specific to LA County, but it's a great explanation and representation of foster youth that are LGBTQ in the system and the reasons for that. So I just wanted to make sure that you've had additional information that you can look at or pursue at a later time. And when talking about family, the obvious definition is that it's a group of people that gives us a sense of identity, belonging, and being somebody. And I'm referencing the work of Caitlin Ryan and Rafael Diaz. They work with the Family Acceptance Project. Caitlin Ryan is actually the director. And what they've done is pretty phenomenal. They've developed research-based materials and assessment tools to gather data. So it isn't enough for us to just know of youth or to understand that, yes, it's a tough time and it's difficult, but to actually look at numbers, to actually look at data that states that many who experience rejection and hurtful words and actions in their families are higher risk of mental health needs and mental health issues at a later age. So we need to decrease that rejection in order to prevent mental health issues for young adults. Here you note that LGBT youth from a rejecting home are 9 times more likely to attempt suicide than their LGBT peers from supporting families. And for Latinos in particular, that's an increase of 11 times. So the importance of how we interact with our families and the relationships and the supportive relationships that we establish with our families is going to be key. And in working in these systems of child welfare, mental health, we need to engage families. It's not enough to just treat the individual, but actually how do we facilitate these conversations that at times can be very difficult, but understanding that we're only talking about acceptance. We're not talking about advocacy. Just simply a small amount of acceptance of your child will minimize the probability that they would try to attempt suicide or have any depression or substance abuse problems. And so noting that for Latinos, our family is very central. It's central to who we are, how we identify ourselves. And when you come from a household of Latinos or Hispanics, it can be a challenge to be that individual if you stand out, if you are not a reflection of your family, or if there's some discrepancies there. So coming out can be very, very difficult, and we're gonna address it a little bit more in detail now. But this is an overall issue because for Latinos, a lot of us didn't even get the birds and the bees conversation. A lot of that is silenced because we perceive sexuality as a private matter, so much so that we don't talk about it even within our immediate family. And so I'll use myself as an example. When I have a single uncle who's yet to be married, is in his late 40s, has a roommate, and nobody will address the fact. Nobody can question him out of that respect for your family. And out of respect for him. But yet the undertone and the silence there is that there's a probability that my uncle is gay, but we won't address it and we just prefer to ignore it. Other concerns that we should look at for Latinos who are LGBTQ is this fear of discrediting your family name. As I've reiterated multiple times, we are a reflection of our families, and so much so that what you do is going to affect those relationships and how they are perceived. So when I got into college, my mom went ahead and she notified everyone on the block, so much so that she contacted family back in El Salvador. But when I came out, that wasn't broadcasted. That wasn't information that was going to be disseminated internationally because there's this fear. There's this ongoing fear of you discrediting your family name. And there's a fear of a bias against the LGBTQ community. And it's important to note that even within the community, there are biases amongst Latinos. We have to create our own spaces. The rainbow flag isn't always inclusive to us in our experiences. And even after coming out, some people could be at a loss. What do you do now? Where do you belong? You're somewhere in this borderland, that this intersection of your cultural experiences and your identity, your sexual identity. And at given times, there are a lot of lack of resources for us as well. So what is coming out? When we talk about coming out, it means something different to everyone. So it's a process, and it's not a clear process for everyone. So again, my guidelines and the information that I'm sharing with you all today is not the same for everyone. But it's important to note that coming out is acknowledging your attraction to people of the same sex, both sexes, or all sexes. It's identifying as one of these acronyms: lesbian, gay, bisexual, transgender, queer, or questioning. And it's important to note that there is a process of coming out to yourself and coming out to others. It might take some time for you to identify, what are these feelings? Why do I get butterflies when I see someone of the same sex come into the room, or that individual in particular, versus deciding to tell your community or even your extended family or your immediate family. It takes different tiers of coming out, so to speak. And in some cases, we've seen that when individuals and youth decide to come out to their immediate families, they're asked to keep that silence. They're asked to wait until their grandparents die so as not to shame them. And so that coming out process is going to be ongoing. And you would have to decide to tell others about your feelings and attractions, and sometimes remaining label-free. Some youth prefer to not be identified as a lesbian or gay or bisexual. They want to be who they are without another label. Some reactions to note for parents of LGBTQ youth is that traditional parents are often going to have feel a degree of disappointment, to think that I didn't raise you right, that something went wrong along the way, because it's hard for them to understand or grasp, and sometimes it's a lack of education to know what it is to be LGBTQ. Because you have a concern that your child is now going to be harassed or discriminated, and I know the media perpetuates a lot of this, but it's important to note that being gay isn't automatic for you being hurt or bullied in school. I think kids will find a reason to bully you regardless of your sexual orientation. And in some cases, we've seen that a lot of youth that are being bullied or harassed or discriminated in school setting is because they are perceived as LGBTQ, but they're actually not lesbian, gay, bisexual, or transgender. Another concern to note is that families are sometimes scared that you're going to contract HIV. And again, these are stereotypes that derive from ignorance, and it's important that we create spaces to educate our families. Or that your child has been sexually abused. There is no research behind this, and it's important to note that this is very much a stereotype and an assumption that you need to unpack with families when you're working with families, or that these kids are being influenced by others. This is not a phase, and by all means, it's not a choice to say, today I'm going to be gay, or tomorrow I'm going to be bisexual. These aren't, again, it's not peer pressure. And most important to note that it's not a personal fail as a parent. I've had families tell me it's because he didn't have a father. Had he had a father in the home, he would have learned to be a man. And it's important to note that none of these factors really influence someone's sexual orientation. And that what is most important, and what I want us to take away, the minimum, is to discuss family acceptance and the importance of this. So some information to note is that research has shown that the single most significant factor in predicting mental health outcomes for these youth is the response of their families. And those coming from highly rejecting families that are at a high risk, at a far higher risk for mental health problems as young adults. And as I mentioned earlier, some of these concerns are suicide ideation, attempts, depression, substance abuse, and other high-risk behaviors. And again, I'm quoting the work of Caitlin Ryan, which would I encourage you to Google or to look into. There's a lot of great material online that's free on PDF files. So let's look at what family behaviors will increase these mental health issues that include suicide. Physically hurting your child. And again, that's how we see a lot of youth entering out-of-home care and foster care and group homes, is for physical abuse. This idea that you're going to beat the gay out of your child. We're also looking at verbal and emotional harassment because of your sexual orientation, excluding your child from any family events such as weddings or quinceañeras or just family barbecues, to not be allowed to participate in those spaces, or to be told you cannot bring your significant other. Blocking access to such events, whether it's Pride or the Gay Straight Alliance networks that you'll see in a lot of different school settings, or not allowing them to hang out with certain friends that you think are gay, or because they represent or because they express themselves in a given way. Blaming your child that they're going to be discriminated because of their identity. Pressuring your child to be more or less masculine or feminine, not allowing them to express their gender in a given way, not purchasing certain clothes for them, not allowing them to leave the house looking a given way. And by all means, as parents, you have that authority, so to speak, but being able to negotiate that and not discriminating and harassing your own child is important to note. And telling your child that God is going to punish them. And as Latinos, religion is very much embedded in our experience. So to use God as a form of discipline or punishment is very hard to navigate and negotiate for a young person. And telling your child that you're ashamed of them or the way that they act will shame the family. That's a big burden and responsibility that a young person without the right coping techniques cannot endure. And you'll see that imposed silence and the effect of that in a child. And making your child keep that identity a secret, as I had mentioned earlier, in a lot of the work that I've done with youth, some of their parents' response has been, don't tell your dad, don't tell grandma, or wait until your grandparents pass away, because I don't want to have to deal with the backlash, or I don't want to hurt your grandparents. But with that said, we have to note that our parents and our families also require a certain level of support in their coming out process. I had a youth who came out to his mom, or was outed actually by his younger siblings. And it took his mom about 2 weeks to finally respond, because in those 2 weeks she was processing a lot of this. He had a whole lifetime to process and understand what his sexual orientation was like, but it took her some time. In this case, it was 2 weeks, but she finally came out to him, so to speak, and said, I'm sorry for not supporting you. You know, I want to know more. And we have to acknowledge that our families have their own process. So there's organizations like PFLAG, Parents, Families, and Friends of Lesbians and Gays, that create these spaces to have conversations. Some families have said to me, I want to talk to another dad. I want to talk to another mom. I want to know what her process was like. I want to know how she dealt with this, how she told the rest of the family. And so a great publication to look at is Nuestras Hijas y Nuestros Hijos, Preguntas y Respuestas para Padres de Gays, Lesbians, and Bisexuals, which is Our Sons, Our Daughters, questions and answers for parents of gay and lesbian youth. And again, a lot of this work is national, so I would encourage you to, again, Google pflag.org and look at these outreach and support groups for families and parents and friends of lesbians and gays. And so now we dive into a topic that's a little bit more sensitive, and my only disclaimer before moving forward is that I'm not calling into questions anybody's religious belief systems, but I do want to create spaces to have a conversation about this, because I don't think we speak about it enough. And we need to note that in Latin American countries, the family of the church often supplements our blood family. So we have hermanos and hermanas, right, our sisters and our brothers of the church, that at a given time have just as much of an importance as your biological family. So when we talk about coming out in this tiered process, now we're adding another group to it. So you're coming out to your immediate family, to your mom, to your dad, to your brother, and now you have your extended family, your aunties, your uncles, your grandparents, and in addition to that, you also have to be mindful of your church family. And that in some spaces, the church will not accept you and will often reject you, and that will dictate some of your family's behaviors and reactions as well. So the importance of supporting LGBTQ-resistant families is to determine if their lack of support is due to their faith, or if they're using their faith as an excuse to support cultural views. And that's something that you need to unpack and understand. And each individual is very different. I don't mean to make these generalizations today, but again, these are guidelines and things to consider when working with youth and families. And LGBTQ youth may be treated as sexual or spiritual outcasts by the church that doesn't support these differences. And in most cases, religion will perpetuate this binary, as we mentioned earlier, Marianismo, when we're looking at females as either saints or whores. So when you must take into consideration, if a young woman comes out as a lesbian, what part of the spectrum will she land in? What category will she be boxed into? And is there a space to create to navigate or to negotiate who she is? And it's very minimal in some religious spaces. So I wanted to also take into account what testimonials look like for our communities in church. And I wanted to include the testimonio of Ruben. So Ruben says, Papá, soy gay. Ruben has decided to take the plunge and finally tell his father, a devoted Pentecostal, about his homosexuality. No more arranged dates with women at the church, no more hiding or sneaking around. He knows what he must do and the consequences that will likely follow. His father's not a violent man, so the hurt will probably not be physical. Nevertheless, later Ruben will wonder if physical pain would have been a better alternative. He has had to endure rejection, isolation, and unbearable psychological pain in exchange for the price of freedom to be who he thought God created him to be. True to his character, Ruben's father tells him in no uncertain terms that he has only two choices: to attend the church's 2 months of salvation classes or forever be banished from his home. Ruben's father will not tolerate a sinner under the shadow of his own roof. As his father spells out the ultimatum, Ruben can hear his mother quietly crying in the kitchen. She has dreamed of babysitting grandchildren, of a daughter-in-law with whom to share recipes, shopping excursions, and gossip. But what she really wants is for her beloved son to be true to God. Unfortunately for Ruben's parents, the Bible is clear: thou shalt not lie with a man as with a woman. In his parents' mind, Ruben is condemning himself to the eternal fires of hell. It deeply pains him to pack his bags and walk out of his home, away from his family and into the overbearing heat of a Texas day. Ruben cries, for he knows God loves him, but he wonders if his parents do. And I include this because it's important to really look at an individual's experience based on everything that we've discussed so far. And here you see his understanding of family and the importance, and his mom's expectation in this heteronormative environment that she was supposed to have a daughter-in-law. And what tends to happen is in a lot of rejecting families, youth will leave, youth will be kicked out. 1 in 3 youth will be kicked out when coming out for the families in the United States. In this case, he chose to walk away. But he didn't call into question his relationship with God. He called into question his relationship with his parents and with his family. And I note a couple of biblical verses to look into when discussing homosexuality. They're very common, and it's what a lot of the community hears. I won't dive into any of them today because, again, this is a larger conversation, but I will encourage you all to look at this great film by Kai Dickens in 2009, Fish Out of Water. It's a documentary that really captures a lot of the work of theologians and the LGBTQ community and juxtaposes those two experiences and really dives into religion and the language and the development of certain testimonies. And it's important to be mindful and to be cognizant of what our LGBTQ youth and populations are experiencing and what they are told, right? It's Adam and Eve, not Adam and Steve. These are very common terminology that youth are hearing, but we need to unpack this. We need to understand in order to challenge. And another great curriculum to look into by the Human Rights Campaign is A La Familia. It's written by Reverend Miguel de la Torre. It's great. It's both in English and Spanish. It's about 5 different chapters, and it's a conversation about our families, the Bible, sexual orientation, and gender identity. I think it's a phenomenal resource. I encourage you all to download it, to print it, and it dives into these different biblical verses that I think we all need to be aware of and just at least take the time to review. In working with families, I think it can be very useful, and again, to be aware of when religion is an excuse or not. So when we're looking at religion in the Bible, something else to note is, of course, we all read the Bible with our own personal biases. So to use such a book or a document against youth or to try to keep youth from coming out can be very detrimental. It can be very hurtful. And the takeaway message here and with the Bible is love. You know, I don't think that this is a document that perpetuates hate or pain. We're really looking at a God that fought for the marginalized and for injustices. So we need to be able to reframe but also engage in these conversations that at times can be very difficult. And to be mindful that not all religious spaces are rejecting, that there are welcoming and affirming churches. In LA County, we're able to Google the Archdiocese website, and on there is a list of those churches that are welcoming and affirming for our communities. So youth do not need to abandon their religious views simply because of their sexual orientation. A couple of other takeaway messages for today is what is it like for LGBTQ Latinos in the community. And for some, experience the shame in hiding their orientations because they believe that there's something wrong with my gender. Something is wrong with me. I'll overcome it. I'll just have to deal with it, but in the meantime, I'll just keep it to myself. And communities that are unaware or unsupportive ask themselves whether LGBTQ persons can change or whether they choose to be LGBT. And it's not a choice. It's an identity. It's who we are, and it's important to note that we aren't here to be, there's no conversion. Right? In the state of California, conversion therapy is no longer legal except in faith-based spaces or organizations. So conversion from one to the other, from being gay to heterosexual, is not an option, and it actually can be very detrimental to someone's mental health. A couple of challenges and stressors as we start to wrap up this conversation is that there is this struggle. There is this intersection of identities. And it's difficult to navigate as an adult, let alone as a youth. And also to note that for our trans population, as it is for Latinos, we have some difficulties accessing health care, as well as lower income folks. But when you're trans and if you're looking for those hormone replacements or anything of that sort, it's going to be very difficult to access this type of health care. And there is this culture clash of LGBTQ persons within the Latino community. Again, the rainbow isn't always as inclusive. At times it can be a two-front battle. And I have a quote here by a youth that decided to remain anonymous and says, at the end of the day, I feel you shouldn't have to choose between one or the other. And we have to note that there is this intersection, that there is this gray area, and there is this crossroad. And we need to be able to understand what that is for each individual and for each youth that we work with. And some of the research that we've quoted from the Family Acceptance Project as well as the Williams Institute is that some ethnic and cultural groups, as we know, for example, first-generation immigrants from Latin America are less accepting of children who do not conform to these standard gender roles here in the United States than families that have been here for several generations. And again, it varies. This is what the research is telling us, and I think it's important to treat everyone as an individual and to honor their experiences as a family. And in California in particular, Latino, LGBT, lesbian, gay, and bisexual are 1/3 less likely to identify as such in comparison to their white counterparts. And for multiple reasons. Up until recently, we really didn't have public figures that identified as LGBT or transgender. We don't have an Ellen DeGeneres, right? We most recently, Ricky Martin has come out and been very visible in the community. But 10, 15 years ago, that wasn't the case. So to not have that mirror image, not be able to say, oh, okay, Latinos are also gay or lesbian, can be really difficult for a young person who's still seeking and is still questioning their identity. So I think that speaks to this the statistic by the Williams Institute. And when we're looking at Latino trans individuals, their experience is rough. This data is coming from the National Transgender Discrimination Survey of 2011, and it states that they experience assault 3 times more than other transgender individuals, twice as likely to experience family violence. Undocumented non-citizens experience physical and sexual assault 3 times more than other transgender individuals, and undocumented non-citizens are 50% more likely to lose their job. So I just wanted to make sure that we honored some of the struggles for our trans population. And it's important to note because at times they tend to be excluded from the conversations of being LGBT. And when we're looking at racism within the population, we have more than 2/3 of LGBT persons from a racial minority group say that there's just as much sexism and racism amongst the LGBT population as there is in the non-LGBT population. So belonging to a racial minority group can be a two-front battle. That's a lot to take on. And so, again, I say all this to be mindful and to be cognizant of what these young people are bringing to us and what type of work that we need to do with them. And I won't have the time to elaborate today, but the other component of this workshop and this presentation come October is looking at what trauma-informed care is and how do we tailor trauma-informed care and mental health services to tailor the needs of these youth and what their struggles and their stressors look like. So Latino LGBT participants were asked by the Human Rights Campaign, again in another great study that is free and accessible to all through their website, is how they're treated by the majority. And 66% said that they were treated like any other. 41% said that they were discriminated against, yet 50% said that they were empowered and encouraged to be a leader in the community. But that is in response to the discrimination. Because there aren't spaces for us, because there isn't leadership that represents us, 50% were empowered and encouraged to be that. And this was from a poll of 261. So with that said, I know I captured a lot, and I hope I didn't speak too fast for everyone, but I wanted to make sure that I was able to share and disseminate as much information as possible. I didn't really get a lot of questions, but we have a few minutes.
Yes.
So.
Thank you, Rebecca. Yes, we have a few questions, so if you want, we can take some time for our questions.
Absolutely.
Okay, great. You mentioned there's a high rates of violence amongst trans population. We have a question here. Is there a difference on sexual harassment rates between Latinos, LGBTQ, and other populations?
As to the violence, yes.
Mm-hmm.
Latino trans are at a higher rate of violence and physical assault than non-Latino trans populations.
Okay.
And you can find a lot of that in that survey that is listed here. Let me go back to that. That will dive more into that, the National Transgender Discrimination Survey.
Okay. Okay, we have a comment here. When is the best age to begin a hormonal treatment when you have a health condition like diabetes mellitus common in youth?
That is a great question, and I think that's going to be very specific to that individual's primary doctor. I know that there are youth that around time of puberty will start to explore beta blockers, which aren't hormone replacements just yet, but will block any, whether it's testosterone or estrogen, depending on your transition. But if you have a condition such as diabetes, I think that that would be a conversation to have with your primary physician. And it's also important to note that identifying that physician that is inclusive and that is supportive is going to be key for any child that is looking to transition, or that they have a supportive family that is willing to explore that option with them. But I have seen that some youth have waited until 18 to do any hormone replacement therapies.
Okay, thank you. We have another question. You discussed being honored by someone who comes out while receiving services. What about the reverse? How should a provider, or if a provider should come out in relation to an identity that might be LGBTQ or heteronormative?
That's a great question. So as I mentioned earlier when I came out to you all, let me just make it clear that the question is whether or not as a provider you should come out, or if it matters that you identify as LGBTQ. Is that correct?
When should you do that?
When should you do that? Okay. That is a great question, and in my experience, it's not a requirement. I've done a lot of focus groups with a lot of youth that identify as LGBTQ, and neither of them have an expectation or have a preference for their service providers to be LGBTQ. I think in conversations, it's going to be on a one-on-one basis, but it's definitely not a requirement. What these youth are looking for is a supportive and inclusive individual, regardless of their sexual orientation. And they don't necessarily expect that as an LGBT person, you are automatically going to identify and empathize with them. They just want their process to be honored by any person, regardless of their sexual orientation. But I think I will leave it to you to assess, based on the rapport and the relationship that you're building with these clients, if and when that is even necessary.
Okay, thank you. So I just want to we have another question. Do we have time for it?
Yes, yes.
Okay. I currently have a 14-year-old girl who lives as a boy. She looks like a boy, acts like a boy, prefers to be referred to as a boy, and is currently dating girls. I have this individual in a group setting for substance treatment, and she recently came out to the group members, and it appears other group members are not knowing how to react to her coming out. So what is the best way to approach when dealing with this type of dynamics in a group?
Yeah, that can definitely be tough, but I think it's a teachable moment. And I think being uncomfortable isn't always a bad situation. I think it creates spaces to address certain needs. And a lot of youth just don't have the information. And if this minor is empowered enough to represent themselves in a given way and willing to share this information, you as the provider should create this space to have a dialogue and to educate the rest of the group based on this, but always ensuring that this individual is kept safe throughout the conversation and is honored for coming out to the group. But I think educating and maybe through films or bringing in speakers or having other peer support come into the group and be able to address this at large, again, I think it's a phenomenal teachable moment for both you and the group as a whole.
Okay.
I hope that answers your question. I don't know if there's a clear answer to that, but I think that it is an honor that you have this opportunity right now, and you could do a lot with it.
Okay, thank you. I want to let the audience know we have a few comments, and I'm going to be sharing them with you so you can get some feedback from our participants who seem to have enjoyed very much your presentation. So thank you. And just a reminder, a recording of today's webinar, it's going to be available, like we mentioned at the beginning of the webinar. Let me get it here. Okay. So remember that we're going to have not just the PowerPoint, but also the audio available at our website, www.attcnetwork.org/Hispanic Latino. Here we have the address. Okay. And also, this concludes today's webinar, but I would like again to thank you, Rebecca Grande, for your presentation, and to remind everyone to please take a look at our website to learn about future webinars. Also, as you leave today's webinar, you'll be directed to complete a brief survey about your experience. So your feedback is really important to us, and we appreciate you taking the time to tell us what you thought about today's webinar. And again, to remind you that we have our conference on October 8 and 9 of 2014. It's going to be at the University of Texas at Austin at the Commons Learning Center. So we have our website, which is www.hispaniclatinoattcconference.com, and there you can get more information about our presenters and all the things that are going to be going on there. So thank you, everybody, and have a great day.
Thank you.